Hey everybody, welcome back to the EKG lectures here with Reed. Today we're going to talk about calcium channel blockers. I'll be honest, these are probably my favorite antiarrhythmics class 4. I don't know why, I just think they're really neat. So let's talk about what they do and why blocking calcium channels is important in the treatment of arrhythmia. So, as the name suggests, they block calcium. And what calcium channels do they block? Well, they really are mostly selective for the calcium channels in our pacemaker potential when potassium is coming into the cell in phase 0, right? So this is our pacemaker potential here on the bottom right. And so by blocking calcium channels in this pacemaker potential, it is going to essentially, by blocking, we're going to block this. What is that going to do? That is going to decrease nodal propagation. And so we can imagine that what that's going to change in this action potential curve is going to look something like this, where we have the rise in calcium, but it's just going to take a little bit longer. And so we're going to decrease the rate of propagation throughout our nodes. And really, we think if we do that in our AV node, what that's going to do is that can slow the AV node. So what are arrhythmias that we think of slowing the AV node down? It doesn't necessarily completely block the AV node, but it's going to slow it down. And so I think this is being incredibly effective in arrhythmias where they are rapidly utilizing the AV node. So that might be good for rate control in atrial fibrillation and atrial flutter. So really atrial tachyarrhythmias, right? Because remember, in these arrhythmias, if I go up to my upper right hand corner, we are having rapid signal propagating throughout the atria and say atrial fibrillation, and the AV node is a bystander, and the AV node is sending that signal down to the ventricles. And if the AV node is healthy and sending it down to the ventricles quickly, we can be getting rapid propagation of signal, often into the ventricles. And if you have too rapid of a heart rate, you can have cardiovascular compromise because the ventricles don't have time to fill. And so we can slow that down by blocking these calcium channels that are specifically located in these nodes. These channels, we can call them, and I call these calcium channels non-dihydropyridine calcium channels. Right, these are the ones that are specifically on the SA and AV nodes. And so that is going to decrease the conduction of our nodal cells. You also have a little bit of a decrease in inotropy, which is kind of the contractility, the squeeze of the myocardium. So these will decrease your blood pressure a little bit. They might decrease a little bit of calcium going into the vasculature and cause some minor vasodilation. So be careful in people that are, overly hypotensive. However, is there hypotension because of the vascular resistance, or is there hypotension because we need to slow our AV node down? The AV node is conducting signal too fast into the ventricles. So this is a great medication for atrial fibrillation or atrial flutter with a rapid ventricular response, where the ventricles are responding rapidly because of this AV node propagating this signal down that is coming from the atria so fast. And so we can decrease that and oftentimes make people feel a little bit better. So this isn't going to control the rhythm. This isn't going to get them out of AFib. This is just going to control the rate. And so I hope this helps you understand these calcium channel blockers a little bit better. Examples of these are diltiazem and verapamil. And remember, these are non-dihydropyridine calcium channel blockers. There are other calcium channel blockers that are dihydropyridine calcium channel blockers that are more selective for the peripheral vasculature and can be good for treating hypertension by vasodilation, because calcium is an activator of our smooth muscles and our blood vessels. And so those are different types of calcium channel blockers. And so these ones specifically are working on the L-type calcium channels that are located in our SA and AV node. So hope this helps you understand the uses of these drugs. And what you'll notice is, I really wanted to make these videos so that whenever I talk through EKGs and maybe some treatments here and there to help you understand the physiology of arrhythmias, that we can better understand these medications. So I hope this helps, and have a great day.